make that decision very early on. But we'll be making additional decisions as they arise, I guess, Tony.
And what about closing the southern border? Is that still on the table?
We're not looking at it very strongly. We're not seeing a lot of evidence in that area. We're closing it, I guess, automatically because we have a very strong border there now. We didn't have a strong border at all. We've built 129 miles of wall, and the wall area is 100% secure. But we haven't seen any great, I don't think we've seen any great evidence that that area is a problem at this moment, so we won't have to bother with that at this moment. Anybody? You're so nice today, I can't believe it.
This is the NIH, that's it.
It's NIH. It rubbed off.
Super Tuesday.
Say it.
Tell us about Super Tuesday, how you're watching the primaries that are taking place.
Well, it's going to be a very interesting evening of television. I think it's really going to be something. It's you've got some races going on that didn't seem to exist a few days ago, and now Biden has come up a little bit, and I don't know what's happened with Bernie. I think they're trying to take it away from him. I don't know if that's fair, but I guess it's politics when you get right down to it, what's fair. But I think it's going to be a very interesting evening of television, and because of the time difference, California time difference, it's going to go a little bit later than we're accustomed to, right? And I will be watching. Who would I like to win? Anybody. I'll take anybody I have to. That's the way it's going to work. Doesn't matter.
Not a favorite opponent?
No, I have. I really just, we've done a great job. We have the strongest economy on earth. We've gone up, and as you know, China's economy has been hurt very badly long before this. We've done a really good job, and I think people understand that. And I'm looking at polls that are very good. But whoever it is, we'll take them on. We have no choice, right? Anything else, Steve?
Did you have a reaction to the North Korean launch of those missiles yesterday?
No, I have no reaction. Short-term missiles, no. No.
And back on the Afghanistan, was that your first conversation with the leader of the Taliban?
I don't want to say that, but we had a very good conversation with the leader of the Taliban today, and they're looking to get this ended, and we're looking to get it ended. I think we all have a very common interest. We'll find out about the country itself, but the country really has to get it ended. We've been there for 20 years. Other presidents have tried, and they have been unable to get any kind of an agreement. The relationship is very good that I have with the mullah, and we had a good long conversation today, and they want to cease the violence. They'd like to cease violence also.
The Afghan government seems reluctant to turn over those 5,000 prisoners.
Well, they may be reluctant. They've been they've done very well with the United States for many years, far beyond military. If you look at all the money that we've spent in Afghanistan, we've spent trillions of dollars, and we're really a police force. We're really not fighting per se. It's a fight that if we had to, we'd win, but I don't want to kill millions of people. We'd win it fairly quickly, but I don't want to kill millions of people. I think it's crazy. And so we've been there. We'll be very, very soon. It'll be 20 years. And I said right from the beginning, not easy to get out of these conflicts, very complex in terms of all of the people you have to deal with, including, frankly, people in the Senate, people in the House, and a lot of people feel differently about things. But I've been amazed at how positive the response is to getting out of Afghanistan and to moving on. And I really had a great conversation with him today, yes.
The meeting today...
Are you considering new guidelines for nursing homes, given the cluster in Washington State?
I could ask you to answer that
So
question.
Mr.
Secretary.
So actually, we have been educating healthcare providers really from day one back in January about the need to be on guard against respiratory syndrome. And then when we had this case of the long-term care facility in Washington, we sent out special alerts to long-term care facilities to be very mindful about infection control, isolation with these most vulnerable of our seniors and other individuals who have comorbid conditions. And that's really what we've been seeing around the world is the prevalence of fatalities have been in the elderly and those who have other forms of medical fragility, comorbid conditions. And so really being on very high alert in our nursing home community is called for.
Mr. Secretary, could you talk about your meeting with lawmakers today and what specifically they're asking of the federal government? What's their biggest concern?
Well, I think it's the same concern that we've all had, which is getting testing out there rapidly into the community so that we can be testing as many people as possible. As you know, our excellent teams down at the CDC developed the test really in record time, within weeks of getting the genetic sequence back in January, and we approved the diagnostic at at the FDA under an emergency use authorization in record time. We've been able to be testing at CDC throughout without any backlog in testing. Our throughput has been great there. We've had 12 labs qualify to be able to do the testing. We did suffer a manufacturing issue on that test as it went out to the rest of the public health labs. We've gotten that issue solved in the last week. So that's up and running in the public health labs. We also have gotten this test produced by this contractor to get it out. So we will this week have up to 75,000 tests shipping out there to public health labs, as well as available to hospitals for ordering. And then something really important happened on Saturday morning. So one of the biggest issues around testing that people don't understand is during the Obama administration, the FDA for the first time asserted control and regulatory jurisdiction over what are called lab-developed tests. Before that, if a hospital or a lab like a Quest Diagnostics, a LabCorp, or an academic medical center would develop a test on their own with reagents and test, they could just do that if they were a certified clinical lab called a CLIA lab. But under the Obama administration, the FDA asserted jurisdiction and said, you have to come to us first and get approval of that test before you can do it. On Saturday morning, Commissioner Hahn issued guidance saying, under an emergency use authorization, we are permitting these labs, these public health labs, these hospital labs, commercial labs, to go ahead, get the test going, do your own test, make it available, and come to us for approval after the fact under emergency use authorization. That will make, as Commissioner Hahn has said, millions of tests per week available quite rapidly.
Mr. Secretary, can I ask you about the study from the CDC today that showed the Americans most at risk of contracting coronavirus are the ones with people living with patients? So should Americans be less worried about catching the virus from, say, people on the street or people in an airport?
So what we said at the press conference just yesterday is very consistent with that, which is for the average American in your daily life, the risk of getting the novel coronavirus is very low. But if you are around individuals who have the novel coronavirus, the risk obviously is higher. And that's why the efforts we're taking with the state of Washington and with Santa Clara County and elsewhere in the country are around what's called community mitigation, which is to isolate individuals who have the disease, as well as to reduce social contact to bring the level of disease spreading down.
Mr. President, I don't know if you had seen reports about the Vice President having shaken hands with students from a Florida school, one of whom have been placed into voluntary self-quarantine. Did that concern you at all? What did you think about that?
I haven't seen that report, no.
I didn't see that either.
Mr.
I haven't
President,
seen
how much money should go to hospitals for the uninsured?
Well, we're going to look at the uninsured because they have a big problem, and we're going to look at the uninsured people that, this came as a surprise to all of us. It just happened. It shows what can happen in life. But we're going to be looking at the uninsured, see if we can help them out.
We're working, as part of the emergency supplemental, we'll work with Congress on programs to help hospitals as they care for the uninsured with novel coronavirus.
Okay, thank you all very much.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
We're going to take you upstairs now.
Okay,
Okay,
let's go.
Guys, we're going, let's go.
and we're going to have Kismetti tell you a little bit about what she's doing, all right? Our young scientist.
Larry, come on over here.
Mike would get it done.